West Africa is home to some of the poorest communities in the world. The West Africa Water Initiative, better known as WAWI, is a partnership of 13 international organizations which seeks to improve the well-being of these communities by providing access to safe water and sanitation. Since WAWI's beginning, some 1,600 village wells and hand pumps and 28,000 household latrines have been installed in the West African countries of Mali, Ghana, and Niger. Some of the most vulnerable members of these poor communities are the physically disabled. Many spend their lives marginalized by society and deprived of human dignity and hope for the future. The disabled often have little or no access to the region's limited public services, such as health and education. Access to safe water and sanitation is no exception. Many struggle daily to maintain minimum levels of personal hygiene, due in part to the daunting challenges of obtaining or using water and accessing sanitation facilities. Disabled women are particularly impacted by these limitations, as they live in a society where their worth is often measured by their ability to draw water and to manage it within the household. The Mali Water and Disabilities Study was established to examine issues of access and use of clean water and sanitation facilities by disabled persons within WAWI target communities in Mali. The study is supported by the Conrad N. Hilton Foundation and jointly implemented by Messiah College and World Vision. Messiah College provides conceptual leadership, conducts laboratory work at its campus facilities, and fields faculty and student research teams twice each year. World Vision Mali supports the study with in-country logistics, community access, and year-round field staff. The study has also partnered with local organizations such as Handicap International, Water Aid, and the Sisters of the Annunciation. To assess the needs of the disabled, the study conducted a survey of nearly 900 households to determine the number and types of disabilities, as well as the challenges they face relative to water and sanitation. World Vision field staff and disabled persons from local communities were trained to conduct the survey. Survey findings were then discussed among participatory focus groups of disabled persons to develop and refine research priorities. Messiah College and World Vision teams have also spent some 300+ hours in one-on-one dialogue, listening to individual stories in an effort to understand their challenges. These challenges are multiple and often complex. Superstructures which surround hand pumps can impede access for those with limited mobility and for those who are blind. Manipulation of hand pumps also poses challenges, not only for the physically disabled, but also for the young and the elderly. Transportation of water from the pump to the home is a major challenge, as is the manipulation of water containers for domestic use. For many disabled and elderly persons, the simple use of a latrine can pose major physical obstacles and health risks. Traversing a yard or field to access a latrine can be challenging, especially in the evening hours. The blind often encounter special difficulties when accessing or using latrine structures. Those with lower body limitations can find it difficult or impossible to maintain a squatting position, and those with limited arm or hand use may find it difficult to clean themselves. Given these findings, the study has focused its work in 3 areas: access and use of hand pumps, transport and domestic use of water, access and use of latrines. With hand pumps, the study is examining how human traffic circulates around village pumps. Low-cost ways to adapt pump superstructures to facilitate access and egress are being developed and tested. Adaptive technologies to facilitate the manipulation of hand pumps are also being tested. The study is also exploring simple, low-cost adaptations which facilitate the handling and transport of common water containers. These include methods of molding and welding local plastics and the development of handle frames to facilitate grasping and lifting. Devices which aid in the dispersal and management of water within the household are being tested, such as bucket and jerry can tippers. Priority is given to innovation with local materials, which are both durable and affordable in the local economy. Locally fabricated devices for persons with lower body limitations are being developed to facilitate access and use of latrines without impediment or health risk. A variety of low-cost walkers and latrine seats are currently being tested for a range of disabling conditions encountered with latrine use. Beyond these applied initiatives, the study is also confronted with compelling questions on a broader level. How can local artisans best be trained to provide locally made assistive technologies? And how are they best persuaded that markets may exist for these technologies in their communities? How can guidelines, methods, and locally fabricated technologies developed by the study be appropriately transferred to other geographic and ethnic regions of West Africa? How can NGOs working in water and sanitation be informed and equipped to assess the needs and challenges of the disabled? How can workshops, community mobilization initiatives, and information exchange best be leveraged in the planning and implementation phases of water and sanitation initiatives to ensure appropriate inclusion of the disabled? How do water and sanitation initiatives such as WAWI assess what levels of special investment are appropriate when it comes to assisting the disabled in broader target communities? These are a few of the challenging issues to which the Mali Water and Disabilities Study is working to contribute answers. In its continuing role of support for WAWI's mission of providing safe water and sanitation in poor communities, the study seeks to assure that the most marginalized members of target communities also benefit from this important initiative. For the disabled, this is accomplished by the creation of enabling environments, which are not only healthy and safe, but also play an important role in helping them become active, participating members of society. When this is accomplished, those things the poor need most are likely to follow: an enhanced sense of self-worth, restored human dignity, and hope for a better future.